Welcome to the regular meeting of the Public Health and Safety Committee for February 28th, 2024. I am Jason Chavez, and I am the chair of this committee. Councilmember Palmisano let me know that she would be absent ahead of time, as did Councilmember Rainville, as he is at the service for the fallen first responders. At this time, I will ask the clerk to call the roll to verify the presence of a quorum.
Councilmember Payne.
Present.
Rainville is absent. Ellison.
Here.
Palmisano is absent. Vice Chair Wansley.
Present.
Chair Chavez.
Present.
There are 4 ayes.
Let the record reflect that we have a quorum. With that, the agenda for today's meeting is before us. Before we proceed with our published agenda, there is a proposed walk-on item that is time-sensitive. A joint powers agreement and common interest agreement for the 2025 joint disparity study. Printed copies of this proposal are in front of us. I move that we add this item to today's agenda as item number 9.
Second.
Is there any discussion on this motion to add this agenda as item number 9? Seeing no further discussion on the motion to amend the agenda, all those in favor say aye.
Aye.
Those opposed say nay. That carries and the agenda is amended. There are 4 items on today's consent agenda. Item number 1 is approving a legislative directive to receive an update on actions related to recommendations from the 2022 MPD and Emergency Communications Center Staff and Operations Assessment. Item number 2 is authorizing a venue contract with AEG Management for bomb detection services at Target Center. Item number 3 is authorizing a revenue contract with Downtown Improvement District in support of summer police and police reserve programs. Item number 4 is authorizing contracts with community-based organizations to implement the racial and ethnic approaches to community health. It's the REACH grant. And item number 5 is receiving and filing an annual report from the Minneapolis Tree Advisory Commission. Are there any discussion on these items, or would anybody like to pull any of these items out for discussion? Oh. Vice Chair Wansley.
Thank you, Chair Chavez. I just wanted to provide a brief overview of the legislative directive that is listed as item 1 on the consent agenda so the public can have context for what it is. In 2022, the city concluded a study of all its calls for service that comes to the police and then broke them down by problem nature codes, also known as P&C. The study looked at the data on each P&C and how well MPD was doing at responding to those types of calls. The study made a number of suggestions about how to divert certain PNCs to unarmed or civilian responders in order to address those calls efficiently and effectively, and shifting the response burden off of MPD. In many ways, this contributed to us, building BCR for what it is today. The study also made recommendations around staffing levels for MPD patrol officers. So this legislative directive asked the mayor to explain which of those recommendations listed in the report have been implemented, and also asked for information about what barriers are preventing implementation and how council can support full implementation of the recommendations that was provided in this report. So I just wanted to offer a little bit more context behind the legislative directive before we take a vote on it, and that is all.
Thank you, Vice Chair Wansley. Seeing no further discussion, I will move approval of the consent agenda, including the receive and file item. All those in favor say aye. 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 Those opposed say nay. That item carries and the consent agenda is approved. The next item is approving the 2024-2025 Public Health and Safety Committee Work Plan. And then, Yvonne, if you can help pull up the slide for this one. Cool. I'm really excited about the process we underwent to get to this point. Vice Chair Wansley and I underwent an extensive and inclusive process that every council member was invited to participate in. As committee leadership, we will be using this plan to guide us in the work that we need to get accomplished this term while making sure our residents are being heard. We hope to be more collaborative than years prior in this committee, making sure that we use our legislative tools to support public health and safety across the city of Minneapolis for the sake of our residents. Now, for the first few slides, I'll pass it to Vice Chair Wansley to address the first component of this presentation.
Thank you, Chair Chavez. And if we can move to the next slide. So basically, we want to provide context for the significance of doing this work plan. So basically, why? Why are we doing this? And the why is essentially, we want to make sure that this committee and the discussions that we have here and the actions that we take here, it's all moving us with this goal of making, Minneapolis a place that is healthy and safe for all. It also serves to help focus the time of this committee towards efforts that are democratically agreed upon, and making sure that, those times and efforts are embedded by shared goals and shared priorities that, we will dig into a little bit more in later in this presentation in regards to what those goals and priorities are. It also helps us to support our committee leadership, which is, Councilmember Chavez and I, to best serve the council and making sure that, again, we're advancing action items, be it through our, legislative functions under policy creation, oversight, and budgetary. We're making sure we're using every arm of authority that we have at our disposal in advancing Minneapolis towards a healthy and safe place for every single resident, no matter where they reside. And of course, and most importantly, we want to make sure that this work plan fosters more public engagement, because that is a critical component of democracy. We also want to make sure that we are championing transparency and accountability, and the priorities and goals that you will see outlined in the work plan is a tool for the public to hold this committee and the council as a body accountable for making advancements towards action items that will, again, help us have a more safer and healthier Minneapolis. And then we can move to the second slide. So as Chair Chavez highlighted, we did indulge in a very extensive process to be able to bring this work plan before this committee and the public today. It started with both committee chair and I sending out emails to every single council member, inviting them to participate in this process. And then we also outlined what this process entailed. And we did that on January 23rd. Fast forward to February 9th. That was the last day for council members to submit their top priorities. So we made sure we gave them time to think very critically, and engage with their constituents around what top of mind priorities are most meaningful to them. And then from February 12th through the 23rd, committee leadership, which again includes both I and Councilmember Chavez, we spent a lot of time synthesizing those submissions into a draft work plan that, again, is before this body today, and making sure that we incorporated every single submission that was submitted to us by council members who participated in this process. And then on February 26th, we, of course, published the draft work plan on LIMS, again, abiding by our goals of fostering public engagement and transparency. So we want to make sure the public could see what are we looking to move forward to guide the work of this committee over the next term. And that happened again on February 26th. And then February 28th, today, last day of Black History Month, we have this work plan in front of everyone for discussion. And everyone is aware. You also have the ability to bring amendments should you see things lacking in this work plan. So that will be the process that we will dive into today. And then on March 7th, should this work plan be approved by this body, it will be moved forwarded to full council for a full adoption vote on March 7th, next Thursday. And then we can move to the next slide. So what's in this work plan, the contents of it? We want to make sure we were very clear about what is the scope of authority within this committee's jurisdiction. We want to make sure that there was awareness of what departments are in alignment with this committee. And we want to also make sure that there was awareness and transparency around external boards and commissions that will be reporting to this committee. We also shared the mission of, this work that we are looking to do this term, we develop core principles to guide this work as well as foundational goals. And as I mentioned, Chair Chavez will be presenting those in the next couple of minutes. And then also we included every single meeting date and time for this body for the 2024-2025 term. I just want to highlight again, we made sure to incorporate all submissions made by council members who participated in this process, and we organized them by topic area. And again, you'll see that once Councilmember Chavez, Chair Chavez brings that forward in the next couple of minutes. We also have a appendix section of the work plan that also shows designated funding sources that support specific priorities to make sure, again, that there's accountability and that we're delivering on priorities that we allocated substantial resources to. So we want to make sure the public can track that work too. So with that, I will pass it back to Chair Chavez.
Thank you, Vice Chair Wansley. This slide, we also wanted the public to know what our committee's scope of authority was. So for the public to know, the PHS committee exercises oversight and evaluation on all matters related to public health and social service programs and initiatives, including civil rights, labor and workers' rights, environmental justice, opioid epidemic response, youth engagement, and all policies and service delivery related to community safety services, included but not limited to emergency management and response, fire and emergency medical services, police, safety beyond policing initiatives and programming, and related matters. Environmental health and environmental services, such as regulation and monitoring of environmental public health issues as well. Next slide. We also have set foundational goals for this committee work plan, and I'll read them right here. It's to develop and implement strategies to address public health issues, such as substance abuse, mental health, unsheltered homelessness, and access to healthcare and childcare. To implement the Minneapolis Safe and Thriving Communities Report to equitably enhance public safety measures, reduce crime rates, and ensure community safety. Support the successful expansion of existing public safety strategies in the preventative and responsive pillars of the Safe and Thriving Communities model. Support the successful implementation of new public safety strategies in the preventative and responsive and restorative pillars of the Safe and Thriving Community model. Fostering relationships with local organizations, other government agencies, and community groups to address ongoing and emerging health and safety challenges. To monitor and evaluate the effectiveness of existing programs and policies to make recommendations for improvements based on data-driven analysis. Prioritizing engagement with our Black, Indigenous, LGBTQIA, immigrant, people of color, and unhoused residents to develop community safety and public health strategies to address community-based issues. And then creating a supportive environment for every child and young person, especially Minneapolis being officially designated as a UNICEF child-friendly city. Now, these are the overall priorities that council members brought up and were included in this plan. Like Vice Chair Wansley said, no one's priority was left out of the process as long as it was in the committee's jurisdiction. If you read the work plan, these will go more in depth on the specific issues on these topics that we can act on. But I'll go through it to give more explanation on it. One of them was overseeing the 2024 public safety budget amendments by the City Council and making sure that they are on the ground to improve public safety for our residents across the city. Overseeing a community-led process of 3,000 Minnehaha, addressing pollution like eliminating polluting projects and expanding PCAR fees to include CO2, auto theft and property theft prevention strategies, addressing behavioral crisis response team staffing, capacity building and infrastructure like improving the city's inspection services, overseeing the implementation of a community safety center, the development of a municipal response to the opioid crisis, which should include increased access to treatment and recovery efforts for substance use disorders, increasing syringe litter cleanup services, increasing access to fentanyl testing strips, and overall an overdose prevention strategy. Environmental justice work like overseeing the implementation of the public health components of the climate equity plan and strengthening our city's green zones. Expanding infrastructure to support workers like establishing a labor standards board, expanding co-enforcement by establishing a line item fee on business licensing fees as an ongoing source for funding of this program, and addressing worker exploitation to address worker conditions, and improve them. Addressing gun violence is a public health concern from the local level and taking action to address gun violence. Improving community safety at light rail stations, transit hubs, and surrounding corridors. Prioritizing Minneapolis as a child-friendly city and making sure we accomplish the goals within that. Overseeing the Office of Community Safety and the enactment of the Office of Community Safety duties and responsibilities. Police oversight that fosters transparency about relevant policies and practices within MPD that impact the safety of our residents. Reevaluating enterprise work, goals, and tools to advance new opportunities in the racism as a public health emergency realm. Addressing unsheltered homelessness as a public health emergency, which will include utilizing best practices to reduce preventable deaths from overdose, exposure, and other causes among unsheltered populations. Overseeing and evaluating the city's response to homelessness and encampments. Support preventative programs to intervene before residents become permanently unhoused, and establishing a humane encampment response policy. And lastly, I'll focus on violence prevention strategies that utilize non-armed street outreach workers like safety ambassadors, expanding community safety programs to other areas including Uptown, support for youth programming to prevent youth crime, and implementing environmental design including lighting as a tool for violence prevention. These are just a few of the priorities that many members of this body and the entire city council submitted to this work plan. And if you go online, you will be able to go more in depth about these specific priorities. And then there is one last slide, Yvonne, if you can go back, but it's about the next steps. The committee and council amends and approves this work plan. This is the process we are undergoing right now. Committee leadership, Vice Chair Wansley and I, will organize presentations and agenda items based on this work plan. All council members and the administration will work collaboratively to advance the priorities in the work plan during the 2024-2025 term, and then committee leadership retains the flexibility to address newly emerging issues and welcomes ongoing feedback from all council members and the public. This is an overview of a plan for the public health and safety, and if there are people, I'll pass it on to Council President Payne.
Thank you, Chair Chavez, and thank you, Vice Chair Wansley, for bringing this work plan forward. I think this is just such phenomenal work, and it's already starting to accomplish some of the goals that we set out when we decided we wanted to put work plans together this term. I just want to give a little bit more context behind the why. The majority of this body was newly elected last term, and now this term we have 2 more new members, and so one of the pain points that we had all experienced was just the inevitable overlap from one committee to the next that is just foundational to policy work that is so expansive for this body. And one of the tension points is, where do certain initiatives belong? What's the home base for those? And already, just through the process of putting this work plan together, we've already started to identify some of those areas where there are some committee overlap. And so what we're doing at the very beginning of the term is we're resolving some of that early in the process so that we're all moving forward confidently with the right committee members engaged and the right staff at the city, in the administration engaged to get this work moving forward, and so that we can get through some of those conflict points early on. And then another thing that was our goal was just to make our process more public and transparent about what we're working on. And already we've gotten some very positive feedback on the work plan, with some suggestions from the public on how we can improve the work plan. And so that's really accomplishing some of the goals that we set out to do. So not only are we clarifying where work belongs early in the term so we can get that sorted out, but we're also strengthening this plan by making it public so that the community can be engaged and follow along. And so I'm really hoping that this can be a guide, not just for this body, this term, but going forward as something that we start implementing institutionally, because we not only was the majority of this body new at the beginning of last term, we were operating under a new model of our government last term. And so hopefully what this is starting to do is really ground us in a really strong planning process so that we can just be that much more effective as local government. And that's all I wanted to share. Thank you.
Thank you, President Payne. Seeing no further discussion, I will move approval of this item. All those in favor say aye.
Aye.
Those opposed say nay. That item carries, and this item will be forwarded to next week's council meeting. The next item is a receiving and filing presentation from Latasha Jennings on the work on Let Everyone Advance with Dignity. Welcome, Latasha.
Closer? Okay. Thank you, Chair Chavez, Vice Chair Wansley, council members. As council member and Chair Chavez shared, I'm Latasha Jennings. I'm the project manager for a program called Let Everyone Advance with Dignity, or otherwise known as LEAD Minneapolis. I want to start by first just acknowledging who our funders who are supporting this work, including the City of Minneapolis, Hennepin County, Greenlight Fund Twin Cities, Thomson Reuters, U.S. Bank, Mortensen Construction, and a previous funder, Alina Health. And I have some good news to share is that since submitting my grant, which will allow us to expand case management capacity for our program, which I'm very excited about. So what is LEAD? Focused on the East Lake Street corridor, LEAD provides harm reduction-based intensive case management to individuals who commit law violations due to unmet behavioral health needs, homelessness, and/or extreme poverty. It is rooted in a recognition that the criminal legal system as usual, such as booking, prosecuting, and jailing individuals committing offenses related to behavioral health needs, has had limited effectiveness in improving public safety. In short, we are a public health response to public safety here in Minneapolis. Our LEAD style case management is rooted in the following principles, including harm reduction, meaning that participants will be engaged where they are, both physically and metaphorically. They are not penalized or denied services if they do not achieve abstinence from drug use or if they don't engage in specific services or seek stable housing. We meet people where they are. Our case management is also participant-driven and intensive. So once the acute needs of a client have been addressed, case managers work with each participant to design an individualized case plan that may include assistance with housing, treatment, education, employment, and other client-identified needs. Our work is rooted in a principle of non-displacement. Because our objective is to increase safety for the community as a whole, we believe that it's unhelpful to achieve success for an individual program participant by bumping them up a wait list of scarce resources at the expense of bumping another community member who needs the same services further down that list. So where existing programs have unused capacity, our case management staff do take advantage of that. And we use our client support funds, our budget funding, to purchase, I should say, and access additional resources that are not otherwise available to our clients. We also utilize and believe in peer outreach and counseling, as well as cultural competency as being key to our program success. So the shared lived experience is highly valued and sought after in candidates for LEAD case management positions, because there is substantial evidence that highly marginalized populations can be successfully engaged by peers whom the potential participants view as knowledgeable about their situation. We also utilize trauma-informed care, addressing and understanding the underlying psychological trauma that participants may have experienced by listening to them and working to integrate their voices into their service delivery plan. And then finally, the LEAD model is a specifically tailored intervention, not only to clients, but to the neighborhood that it serves as well. Recognizing that every neighborhood has its own unique character, and that rather than attempting a one-size-fits-all or uniform approach, our intervention specifically is designed with flexibility to be adaptable to various local contexts. Specifically, LEAD Minneapolis serves the pictured geographic scope. As I stated earlier, we serve the East Lake Street corridor, specifically East Lake Street from Chicago Avenue as its western boundary, down to Hiawatha Avenue on the east, and we stretch 2 blocks north to 28th Street, as well as 2 blocks south to 32nd. I also want to share that the LEAD model is one that is national. LEAD Minneapolis is one of over 80 other LEAD sites across the country doing this kind of work. It is an evidence-based model, and the LEAD flagship site, LEAD Seattle, has shown evidence in reduction in recidivism as well as associated criminal legal system costs for individuals engaged in LEAD case management services, as well as an increase in access to shelter and housing supports, as well as an increase in participation in vocational training towards stable employment. The LEAD model itself has undergone a number of evolutions. As I stated previously, this model was created and founded in Seattle, Washington, and that was started in 2011. And in 2011, this model was implemented as law enforcement-assisted diversion in Seattle, Washington, with 2 referral pathways for law enforcement officers to divert individuals into a community-based system of care versus an arrest. So law enforcement officers had the ability to make a pre-arrest diversion at the time of an arrest and use their discretion to divert that individual into LEAD instead. And then the program also grew to involve what LEAD National calls social contact referral. So in addition to being at a moment of arrest, if a law enforcement officer saw someone in need in community, they could make that referral right then and there. In 2020, the model further evolved to incorporate a community referral pathway under the Let Everyone Advance with Dignity name, and that is the model that we are implementing here in Minneapolis. What Let Everyone Advance with Dignity means is that we have decentered law enforcement as the gatekeepers into LEAD services, and for our program, the referral power is placed directly into the hands of community members. So for LEAD Minneapolis, that includes individuals who live, work, and or play along the East Lake Street corridor. Next, I'd like to talk a bit about our local LEAD Minneapolis model structure. Our local implementing partner is Pillsbury United Communities. It serves as the host organization for the program and provides fiscal and project management support, including serving as my employer for this work. Pillsbury United Communities also employs our direct service case managers. And I'd like to take a moment to recognize my team that's really instrumental in doing this work in community and on the ground, including our case management supervisor, Maria Zavala, and our 2 case managers, Ashaki Brown and Pinky Garcia. Pinky Garcia actually spent 7 years as a LEAD Seattle case manager when it first started there, since moved to Minneapolis and joined us here, and has brought a wealth of wisdom and knowledge from their time in Seattle with their LEAD program. Our LEAD model, as I said, is hosted by a local nonprofit organization, Pillsbury United Communities, but there is a governing body called our Policy Coordinating Group that collaboratively comes together to provide collective governance to this work and ensures that this sort of alternative public safety response in practice is actually hitting the goals and metrics that we want to see. That includes stakeholders from the city of Minneapolis, including our Office of the Mayor, Minneapolis Police Department, specifically 3rd Precinct, our Minneapolis City Attorney's Office, as well as Councilmember and Chair Chavez as the representative of Ward 9. I also am in conversations with Amanda Harrington in the Office of Community Safety, and I'm hopeful that they will be joining us as a policy coordinating group member as well. From Hennepin County, Health and Human Services sits at this table, as well as the County Board Commissioner for District 4, Commissioner Angela Conley. Metro Transit Police Department is a stakeholder, and then we also have a host of community and business stakeholders, including our implementing partner and host organization, Pillsbury United Communities, Thomson Reuters, St. Vincent de Paul Thrift Store, which is a thrift store on Lake Street at 12th and Lake, Lake Street Council, the business association for the corridor, as well as Greenlight Fund Twin Cities. Some of these policy coordinating group members also dedicate staff to support this work at an operational level on what's called our operational work group. And so this work group's goal is to conduct collaborative care coordination for the betterment of LEAD clients. In addition to our LEAD case managers, it consists of representatives from the Minneapolis City Attorney's Office who help us navigate clients' outstanding criminal legal system matters. as well as representatives from Minneapolis Police Department, 3rd Precinct, Metro Transit Police Department, social workers, and other staff from Hennepin County Health and Human Services, as well as the county's Department of Community Corrections and Rehabilitation. So this group comes together every other week to look at our shared caseload and to all, knowing that because our clients are likely oftentimes touching multiple or all of these agencies, this operational work group and the information sharing that takes place in it makes sure that each member agency is aware of and aligned around a client's case plan. And each of our clients signs a release of information to allow for this collaborative case planning approach to happen. Additionally, community voice is important to implementation of Lead Minneapolis, and we have a community leadership team that consists of residents, business owners, advocates, violence interrupters, and other community-based service providers with a stake in public safety on the East Lake Street corridor. This team has been incredibly instrumental in supporting development of Lead Minneapolis's community referral process, and will have an ongoing voice in ensuring Lead Minneapolis is responsive to community need. And I do want to underscore, too, that Lead Minneapolis is one of the first sites nationally to start their program with community referrals, and so this group in particular really helped us build that from scratch for our site. So who is eligible for Lead Minneapolis? Our eligibility criteria include the following inclusion criteria. There must be reason to believe that the individual is exposed to the criminal legal system because they commit law violations related to behavioral health needs or experiences of homelessness or poverty. Our program is completely voluntary, so that individual also must be amenable to engaging in a community-based case management alternative to the criminal justice system. They must also be a resident, and that includes individuals who are unhoused residents or a frequent visitor of the East Lake Street corridor within our geographic scope, and they must plan to reside in Hennepin County for at least the next 6 months. And then our program serves adults, so they must also be 18 years of age or older and be able to provide informed consent. We only have one exclusion criteria, and that encompasses whether if an individual poses an immediate risk to themselves or others, or if they're experiencing a medical emergency that necessitates an immediate 911 emergency response. And next, I want to share a little bit of information related to preliminary client data. And I want to start by grounding us in a few pieces of background around this data that I'm going to be talking about. So first, lead case managers maintain caseloads of 25 or fewer clients to maintain an intensive level of service delivery. At the time that I submitted this presentation, I included that we were currently serving 48 active clients. In the past few days, that number has already increased to 50. So if you're doing a little bit of math and hearing maximum caseloads of 25, knowing that we have 2 case managers, we've quickly maxed the capacity of their caseloads, but I do want to note that that's a revolving number. So as individuals move to a lesser level of intensive engagement, that opens up a new slot for another person to come in. Our referrals began in March of 2023, so we are just approaching a year of case management operations. And I also want to note that this month alone has been a pretty unique month in terms of our referral volume and numbers. We have received an influx of approximately 20. That number is constantly growing too. Of 20 referrals this month, due in large part to referrals from Camp Nianacossie, which relocated to our geographic catchment area in early February. And so I do want to take a moment to recognize and shout out Nicole Mason, who has been an integral community partner and advocate on behalf of residents at Camp Nianacossie, who has been the referrer for those 20 plus individuals that we are now serving. And every single referral that Nicole has made to Lead, that individual has consented to services. So we have a 100% referral to enrollment conversion rate for each Camp Nianacossie resident that has engaged with us or has been referred by Nicole. So that is an amazing number. And I will say as a service provider, a little not common, I would say, and it's really a factor of the relationship that she has with individuals, the trust that she has in LEAD, and that trust transferring over to people being willing to engage and trust us as well. Our work is very relational, and it's built on trust and relationships. So, there are, multiple truths related to encampments. Yes, they do present a public health and safety concern to communities. And yet what we're seeing is that encampments are currently the default outcome that we have due to a lack of low barrier, adequate supply of low barrier shelter options and shortages. So I'm especially looking forward to working collaboratively with the city around next steps for Camp Minneapolis residents, ensuring that they get the care and services that they need. And I also just want to state as well that, we are starting very intensive work with Camp Minneapolis residents. That work takes time, and encampment closures can introduce disruptions to care provision. And so really want to emphasize and stress the importance of that collaborative, the need for collaboration between service providers like LEAD Minneapolis and city administration around addressing encampments in this city. So who are our clients so far? The majority of them are men. So 60% of our enrolled active clients as of today are men. The majority, most, 81%, identify as Black, African American, American Indian, or Alaska Native, or multiracial. So it's very important for us that we are serving individuals who are overrepresented in both our criminal legal system, who are overrepresented in terms of experiencing or being impacted by substance use or mental health conditions, and homelessness. It's a lot of intersections come together, and we see that most felt and impacted in communities of color. And then as far as age, most of our clients are on the younger side. The majority are 75 years old or younger. And we're seeing our largest age group being the 26 to 35-year-olds. And then finally, for each of our current active clients, we have made a total of 810 service delivery contacts. The majority of those you will see are client contacts, and that's a factor of LEAD case management's relational, non-clinical, street-based style and approach. Client contact includes activities to establish, maintain, and reestablish case manager-client relationships. That looks like a client calling their case manager, and maybe they just need to chat for an hour, and that's okay. So we'll take that phone call and speak with them. And that may happen several times a month and several times a week, and sometimes people just need to feel heard by someone. And so we do that kind of work. And, knowing our clients' favorite ice cream flavor or things that they enjoy, that's the kind of service delivery or the types of things that our case managers are doing in that client contact bucket. We also support clients with legal services, namely working in partnership with your city attorney's office to navigate and understand what criminal legal system outstanding matters do folks have and what are the next steps to resolving those. Ideally, a resolution that leads to that person being able to stay in community and progress on their case plan, whether that's getting connected to healthcare, social service, or housing supports. Our case manager set up a number of meetings, but again, we're very street-based, so we recognize that meetings don't work for every one of our clients. So there's a lot of street-based outreach and connection that happens. We also have a bucket of client support funds. So as I mentioned before, where there are gaps in existing supports and resources, we use our funds to fill those gaps. And I want to talk a little bit, too, about what's to come. So as I stated at the beginning of this section, we are just rounding out on a year of case management operations in this program. And there's a number of other data points that we collect at both baseline and 6-month follow-up periods, including data on clients' criminal legal system involvement at baseline, understanding where they were at before their involvement in LEAD, and so then we can track them over time in this program. In addition to criminal legal system involvement, we also collect data on clients' physical, mental, and chemical health conditions and their connections to care for those conditions, with the hope and goal of increasing their connections to care for their health conditions. And then we also track employment and housing status over time. And so we are getting to a point where that 6-month follow-up period is hitting for some of our clients, and we're getting even closer to a year for a handful. So as we collect more of that data to be able to share significant outcomes about that, I'm excited to be able to come back hopefully one day and share that with you all as well. And so with that, I will pause for if there are any questions.
Thank you, Latasha, and for the work you and Lee do for our community. I'm especially appreciative of the work that you all are doing with this. You said 50 clients now, which seems like overcapacity. And then did want the public to know that this is the city council helped fund this project too. So we invested $250,000 into this in December because we believe in the work that Lee does, and we believe that this work needs to continue for the years to come. It not only helps our residents on Lake Street, but the surrounding area as well. So I really appreciate this presentation and the work you all are doing. Do any of my colleagues have any questions? Council President Payne.
Thank you, Chair Chavez, and thank you for being here, Ms. Jennings. We really appreciate the work that you do on the ground, and I've been able to see it firsthand. And, you know, there's the issues around encampments and our unhoused population have been so complex, and it feels very impossible to solve them, but you represent an actual solution to this if people will open their eyes to it. And my question is, looking at the 25 cases per manager, 2 managers, and you're already at capacity right now, do you think that it would scale kind of 1-to-1? You know, if you had 3 managers, would you be managing 75 cases? If you had 4, would you be managing 100? Or do you think there's a cap to this model?
There is no cap that I'm aware of. Lead Seattle started with about 6 case managers, and they're up to 30.
Wow.
And I think they may be the only site that's serving the city of Seattle citywide. And so each individual case manager, as we add additional capacity, that's an additional 25 individuals that can be served by our program. So hoping to hire a third to be able to bring that up to 75 and then add additional.
So it's, just to be clear, with funding for that level of staff, you could ramp up the type of service that you can do and the number of residents you can serve with that model.
Absolutely, yes.
I think that's really important to know for both the members of this body and for the public, right? There is an approach to some of these really complex challenges. We just need to find the money to fund it, right? And then the other question I had, I'm wondering, like, the timeline of the case management. You've only been up and running fully at least the current capacity for a year. You have 50 residents that you're serving. Will they eventually roll off? And what's that timeline for getting opening up new capacity with your current case managers?
That is as unique as every single one of our clients. Our goal is to always work with clients, give them the support that they need to reach a level of self-sufficiency. And so then we can label them as an alumni of our program and open up a spot for someone else. And so it's a ever revolving number, and our case managers review their caseloads to assess where there may be additional wiggle room for additional clients. And I'll say too that once a person enrolls in LEAD, they have access to LEAD services for life. So we hope that individuals, and we work with them to get them to a point of graduation. But if ever anyone needs a higher level of support down the line, they can always come back to us and receive that level of care again.
Excellent. And then my last question is, do you have a direct point of contact at the city that is, at the cell phone level, reliable person that you can call day or night? Or is that something that we should be thinking about when we're thinking about our encampment response and making sure that we have staff available for that type of coordination?
Thank you for that question. I think that there's always opportunities to increase who we're engaging with in that level of communication with city administration. I will say one of the individuals that is always just a phone call or a text away is Inspector Gomez of 3rd Precinct. Whenever there's a question or a need, he is that line of communication and contact. I think there's opportunity for increased communication, though, with Department of Regulatory Services related to encampment response, as well as other areas of the city that may be involved in that.
Thank you.
Thank you, President Payne. Vice Chair Wansley.
Thank you, Chair Chavez. Also, thank you, Natasha, for coming and giving an update on this work that you all are leading to provide services to a critical constituency of ours, and I do count our unhoused neighbors as a constituency. They are people, they are humans, they matter, and we should treat them like any other constituent. That said, also shout out to Nicole. Really beautiful to hear about the importance of having strong relationships develop with those who are experiencing housing insecurity and what that can mean in transitioning them into care or service. So really great to hear the emphasis on that, and that is something that she's constantly highlighting in the work that she's doing in Camp Nanakoski, and often where we overlap here in terms of recognizing the importance of that here in the city and within this administration particularly. The question that I had was I'm really interested in knowing how you all came to your metrics of basically success, like you're mentioning here of like data to come, like the benchmarks, because that's a conversation that we're having here, especially around this issue around unsheltered homelessness. How are we actually measuring our effectiveness in meeting the needs of those residents, be it through our HR team, homeless response team, or through our collaborations and partnerships with other organizations like LEAD and I believe Helix even. So would love to hear, how you all came to develop these benchmarks.
Thank you, Vice Chair Wansley, for that question. So as I mentioned before, we are one of 80 other sites and who have done a number of evaluations. And so what has informed our metrics, especially related to criminal legal system involvement, because we are first and foremost an alternative public safety response. And another underlying goal is to increase connections to healthcare, social services, housing supports, and employment supports, really getting at those social determinants of health, a public health principle. And so we have preliminary benchmarks based on evidence of impact at other sites. This is actually a conversation that I'll be going more deeply into with our policy coordinating group stakeholders, including the City of Minneapolis representatives at that table, Hennepin County, and our community stakeholders, because this requires, we can set metrics, but in order to hit them, it requires every individual, every agency at that table to take an accountability piece in helping us achieve that. So we will be sitting down with those stakeholders to set our group understanding of what our metric thresholds are and what we're hoping to see across those criminal legal system, health, and social service domains.
Awesome. And then on slide 24, I wanted to know if you could dive a little bit more into like some of the components of client contacts or services that are being most identified as needed through your client contacts, as that's a substantial number right there. So, yeah.
Thank you, Vice Chair Wansley. One of the biggest ones that always comes up is phone access. The majority of our clients, particularly those that are currently unhoused, do not have access to a phone. So that's where we're spending a lot of time outreaching, going to them, meeting them where they are. And then when there are changes in the community, whether that's an encampment closure or something like that happens, it causes that disruption in communication, and it makes it harder for us to follow up with them. The phone, and getting a phone without an ID, that is one of the biggest challenges that we're facing right now, in addition to a lack of shelter and housing, but shelter and housing with intensive wraparound services coupled with it. To really meet the true volume of need for that kind of shelter.
Thank you for flagging that. I don't think that's often something that would just come, to the top of mind and thinking of like a most pressing need, but the ability to be in communication with your case manager, to be routed to service. If you don't have that critical device that allows you to have that communication, then that from the jump it makes things very complicated. So thank you for flagging even the importance of a phone and also how that complements of lack of access to identification, which I know we often hear as a negative impact of our encampment closures, of people lose their IDs. And as someone who has unfortunately have lost their IDs, it's not often an easy process. I can't imagine, this is as someone who has stable housing, has a car. If you don't have that, trying to go through the bureaucratic channels to get your ID, you have to have a mailing address to receive it, all those things. It puts a lot of things into perspective that can be easily overlooked. So thank you for flagging that as even a critical need as we're thinking of how do we show up better in this work as a city.
Thank you, Vice Chair Wansley. I do have one last question. Besides sustainable funding, what else do you need from the city to make sure that LEAD's program is successful?
Thank you, Chair Chavez. There is, I think, a great opportunity to streamline or build systems whereby our case managers can also share information with city employees who are engaged at an operational level with us and with our county partners who are also supporting our clients. One of the technical challenges is finding a platform that works across a community-based organization, the city of Minneapolis, as well as Hennepin County. SharePoint hasn't worked very well. Google Drive is often blocked by County Health and Human Services. So there's that technical piece where if we could build those connections of communication across sectors and across agencies, that could greatly improve our communication and ability to collaborate.
Thank you, Latasha, and thank you for being here. My last comment in this item is that I hope that this program is included in the mayor's budget for sustainable funding this year, so that my office and Councilmember Chowdhury don't have to make another budget amendment to continue the program. We know it's working, it's effective, and when programs like these exist, we should be investing on them because it's keeping public safety in our corridor. So I just thank you for being here and for supporting our neighbors throughout some of the most difficult moments right now.
Thank you, Chair Chavez, council members.
Seeing no further discussions or questions, I will direct the clerk to receive and file that report. Now we're going on to discussion item number 8. The next item is receiving and filing a presentation on safe outdoor spaces and various encampment responses. Here to present on this item is Sheila Delaney.
X? Oh, sorry, escape. Oh, thank you. Thank you. Yes. Okay. Hi, thank you, Chair Chavez. Thank you for all of you for being here. I just want to say something before I get rolling. It is incredibly heartening to see you all up there. I know each of you, in your own way, have demonstrated firm commitment to addressing this issue. I also want to say I see who's behind me. You have some very committed community members, some former staff people who care about this issue deeply. And thank you, Ms. Jennings and LEAD. It's another example of things going in a more positive direction. But I want to start with something that I think is important for us to ground ourselves in. I think most of you are aware, last year the Journal of the American Medical Association conducted research on the impact of homeless encampment sweeps. And I just want to ground us in this quote. Sweeps, we predict, will contribute up to 25% of the deaths among this population over a 10-year period. This is from Dr. Joshua Barakis, who is a professor at the University of Colorado. He goes on to say, to put that in a different way, it means our states and our cities are literally killing people with this. So with that, I thank you for allowing me to put some information together that will be hopefully helpful to you in your work as you try to create a better response for our unhoused neighbors. You all are very well versed in this issue, and I appreciate Chair Chavez's effort to enter this information into the record. So I'm going to be very quick as I fly through these slides because I want to leave enough time for some questions. So we're going to talk about background, what got us here. We're going to talk about what the city has done really well. And we're going to talk about areas for improvement, of course, and talk a little bit in depth about what a safe outdoor space is and what it doesn't have to be. So our current reality is this, and we all are aware. We don't have enough affordable housing. We don't have enough net shelter beds, and we certainly don't have enough low barrier to entry shelter beds that employ harm reduction practices. Only a small percentage of the shelter beds are low barrier, and I think this committee is aware, but I will go on to talk about why that's critical. The root of the problem, I think it gets, as I appreciated Ms. Jennings saying, there's multiple worldviews when it comes to encampments. But let's consider that the encampment itself is not the problem. The problem are the conditions that led us to having people living outdoors. We have exiled a significant amount of our population. We engaged in something called sanitization of downtown in the 60s, which basically took away deeply affordable, naturally occurring housing that was like single room occupancy. And we can see the result today, not only in the lack of historic buildings, but in the lack of those kind of housing resources. We, as a country, engaged in something called quote unquote voluntary relocation. It was encouraging people to leave reservations, to come to the urban core, truly to reduce the amount of organizing and building of power in those nations. And ironically, in the city of Minneapolis, that led to the creation of the American Indian movement. So I guess that didn't work for the federal government. We disinvested in African American communities. We made it impossible to build wealth. We destroyed communities. We destroyed commercial corridors. And I really like to share this analogy. I think you may have heard it, but I want it read into the article, the record. This is from an article in The Atlantic from last year, but many experts use the analogy of the game musical chairs when they talk about housing. So it simply means that if you begin a game of musical chairs, you start with a finite number of chairs, and you don't have enough chairs for everyone. So at the end of the game, you might have a child that has a little bit of trouble moving, you might have a child that just wasn't lucky, and you might have a physically more strong child. But at the end of the day, it's not the fault of the people that don't get the chairs. The inevitability of chairlessness is because there aren't enough chairs. So we don't have enough chairs. We don't have enough housing, we don't have enough shelter resources, and we don't have enough resources funding the services we do have. This was from an article by Susan Dew last year. We often find that even our congregate shelters are full. I also want to address an issue that I heard that came up in this committee several weeks ago, is the attribution fallacy. It is true that roughly 30% of people who are experiencing homelessness in the United States today have a substance use challenge. Many of them did not have that challenge when they first became homeless. And truly, if homelessness was caused by substance use, then a state like West Virginia, which has the highest rate of opioid use disorder, would be the state with the most homelessness. And in fact, it isn't. So Ms. Jennings did a great job of showing who's experiencing homelessness. The people experiencing homelessness are the people most impacted by those historic conditions that I referenced. Just rolling through some recent historic context, we saw the Wall of Forgotten Natives. The city responded robustly in partnership with the Red Lake Nation. They created the Navigation Center, which actually ended up in creating some deeply affordable, culturally specific housing. That's a picture of the Navigation Center. There were some great results from the Navigation Center and lots of lessons learned. People got connected, and connection really is the thing that's missing that we'll talk about a little bit further as we go on. But there were challenges. People were reluctant to leave their little space, their bedding, because they didn't want to leave their belongings. So that made it difficult to engage with service providers. There wasn't privacy, and you had a situation in which people were sleeping in one space and their hygiene, their restrooms and their showers were in another. So it was during the height of winter, and that was really difficult to keep those things working. I want to take a second to recognize the enormous community commitment that there's been to this issue and helping our unhoused neighbors. Powderhorn Park neighbors organized to assure that people could have temporary sanctuary space, refuge space. People with lived experience have been organizing themselves all along, and in some cases it's formal. In the case, for example, Street Voices of Change or Envision Communities. Community members have robustly organized themselves, and I really want to call out the the Minneapolis Northside Mutual Aid. Sometimes I hear people talk about, quote unquote, the activists, and sometimes they don't say nice things. But I want to point out that this organization has incredibly transparent bookkeeping, and if you gave to them, you know exactly where it went, and that's reflected in a lot of mutual aid, and specifically Encampment and Okazi also handles funds and resources in that matter. There's a lot of expertise in the United States about how to do this better. So I'm just pointing out some resources. I'm not going to spend a ton of time on these particular slides, but the common wisdom is to go where people are. And some of the other best practices, this is actually from the Los Angeles Homeless Services Authority, is to allow ample time to build relationships, to make sure, as Ms. Jennings stated, to make sure that service engagement is voluntary and not coercive. And that would also be very important when we get to safe outdoor spaces. And you know what? The city of Minneapolis knows how to do this. In fact, Councilmember Ellison was very much engaged in this effort I'm going to speak about. When you bring navigation resources to encampments, you don't have to displace people. You don't have to face those consequences. There's a lot of benefits from the public purse's perspective as well. But I want to speak a little bit about what was done at the Near North encampment in 2021. So the city and county worked together to provide a service tent. And it was pretty, again, a lot of these, everyone likes to say this is a very, very tough issue. In some ways, it's a very simple issue. So people had resources they needed. They were greeted with hospitality. They had cookouts and all the things that build community and trust. They had health care. And they had the access they needed right there to county case workers to get connected. This is really hard to see on the big screen, but I wanted to show you some documentation from that event. So you can see on your left the goals for the service tent. And if you note, one of them is that no one is unhousable. No one is unhousable. And so in order to access the resources they need, people have to have a rapport and a trust in the system that, for many people, has hurt them. So to rebuild that trust takes time. And you can see this is the blacked out parts of the calendar are the people that conducted the services. But the city and county provided everything from health care to connection to general assistance, to vaccinations, to direct access to case management. There were people there from the veterans team. There were people there specializing in specifically people with multi diagnoses. And it was really effective. And I think Councilmember Ellison was very involved in making sure this could happen. This was a group of people that before the service tent was provided, the city of Minneapolis told its staff that they couldn't go there. And the county said that they couldn't go there because it was so quote unquote dangerous. Well, that said, all of those service providers were there. To be honest, we all had a great time. But most importantly, of all but 2 people from that group of 30 were housed by December. It works. But the city doesn't always do what it knows best. So many of you were part of asking for an accounting of how much encampment closures cost. They cost a lot. We frequently see a lot of MPD personnel when encampments are closed. And I just want you to know, which I think you are aware, many other cities do not do it this way. There is another way. We are also not great at caring for the neighbors who are most impacted by encampments. And most of us have seen this picture. This is cement. I don't know where the cement came from, but it was poured on a residential lot, I guess, to prevent people from moving back. And you just have to ask, does the city behave in that similar way in Bryn Mawr or Kenwood? So sweeps don't end homelessness. They cause a lot of damage. They don't get the result we're all looking for. Lots of cities do this differently. I just brought up the city of New Orleans. I happen to live in New Orleans now. I want you all to get in touch with the staff people that are involved in this. The entire city enterprise is engaged in a very holistic encampment response. And not only the city, but also the equivalent of Meet Minneapolis, the equivalent of the Minneapolis Foundation, the head of the Continuum of Care, all work together, and they've been very effective. So I just wanted to let you know that that's happening, and I would love to talk more about that if you're interested. And you all have been trying, and administrative leaders have been trying, community members, and most certainly people who are living outdoors to do this better. The city did hire a homelessness encampment manager. She tried to do what New Orleans has done, but that position does not exist any longer. Neighbors, advocates have been trying to find solutions all along the way. And most importantly, people like Nicole and others have been organizing themselves. So what's a safe outdoor space? I know you have that on the table. I want to say what it isn't. It isn't a free-for-all. It isn't saying, oh, people can camp wherever they like. Many U.S. cities do this. This isn't even inclusive of all the cities that have it. And if you note, there's cities from all over the country. This is a slide from Safe Outdoor Space in Colorado, in Denver. What is it? It's a public health response. And those resources are there for them to dive into. And this is actually from the city of Albuquerque, and it clearly articulates what it isn't. And it does specifically say a place where hygiene isn't present. So I think that's a key, that all these cities that are doing this well provide the resources they need for the people who live there. Duluth, Minnesota is doing this. They've opened something called Safe Bay. That's a safe parking spot, but they're also working in partnership with this whole coalition to create safe outdoor spaces. Now, I want to say they're pausing that right now because of the lack of resources in the entire system. It's very hard to staff these responses right now. And they are working towards an Avivo Village indoor village model. So that brings us to Avivo Village. Avivo Village was specifically designed to overcome any barriers people had to coming indoors and accessing services. It's been very successful. Here's recent January data. To date, almost 200 overdose reversals and now 200 people housed. Safe outdoor spaces don't have to look a certain way. It's up to you to define. In the same way you define what a multifamily housing would look like and what is acceptable, what isn't, it's up to you to decide that. But you can see what cities have done. They can be micro units, they can be palletized movable shelters. In New Orleans, we're starting to work with Habitat for the New Orleans area to create similar, something maybe more along lines of what Albuquerque has done. I want to talk about Denver because the climate is very similar to ours. They have a lot of safe outdoor spaces, and they're successful even simply using these, they're ice fishing tents. And there was a tremendous amount of resistance at first. It was supposed to be a temporary response. The mayor was very much against them, but now the mayor is sold. They've invested deeply. They've enacted legislation that will allow them to continue because they're really effective. This just gives you some statistics. I want to caution you. There's a lot of ways this can go wrong. And I think it's key to make sure that some cities have created outdoor spaces and they have used them to enable in my opinion, you've asked me to do this, civil rights violating policies. They're creating a dichotomy where, hey, we have these safe outdoor spaces, so now you can't be anywhere else. That's something that is very destructive, and I don't recommend you do that or let anyone else do that. And also, they have to be very intentional and managed. And, this idea of professionalization, we do need professionals in the field, but the key piece of what is working is when people connect, and people connect best to their own community. And so people like Nicole and others, I really personally would like to see people like Nicole resourced. They provide an incredibly valuable service, and in some cases, they're represented as someone causing a problem when really they're part of a really workable solution. So this is my final statement. I am not saying that all these cool indoor villages, safe outdoor spaces are better than a home. They're not. But we don't have infrastructure to address the problems we have. And so it is your job to create that infrastructure. And anything I can do to help, I will do. And really, again, thank you for your leadership, and thank you for all the community members that made it possible for all of you to be here. And actually, thank you to all the people who are currently living outdoors. And I think we should feel ashamed that we're at this point, because we know better. So that's it. I'll stand for questions.
Thank you, Sheila, for that presentation and for all your work to help this committee with evidence-based solutions and with your expertise to figure out how we can move forward as a city. I'll pass it on to Council President Payne.
Thank you, Chair Chavez, and thank you, Ms. Delaney. This is a really wonderful report. It really grounds us. And again, broken record, there are actual solutions to this problem if we're willing to commit to pursuing those solutions. I was able to join Councilmember Ellison on a site tour at the Denver Safe Outdoor Space, and that's what really got this on my radar. And we just saw the conditions there, and they were very clean, they were very structured. There was a lot of supportive resources there, and I just couldn't see why we couldn't have a similar approach. My question is, and this might be for either you or Ms. Jennings, around your experience or perspective on peer support, and you just kind of raising Ms. Mason's role at Camp Ninukasi. This has been something I've been thinking about a lot, and I'm just wondering, are there models that we can replicate around peer support? I actually got to do a site visit in Portland for the Portland Street Response, and they had a peer support specialist role there, but I'm just wondering if there's any other models we should be looking at, any cautions that we should have. I've heard some feedback that you want to have at least enough distance from the lived experience, so like the person who's supposed to be the peer support specialist doesn't fall back into the lifestyle. Are there other things that we should be considering?
Thank you, Council President Payne. I would just point out that you do have peer support-based outreach right now. The Twin Cities Recovery Project is providing that outdoors. Peer support in itself needs to be better resourced, and also it can go haywire just like any other service. But I do think that, in fact, when I think about Nicole, that popped into my mind, right? Is there a way we can start getting resources to people with lived experience who have enough distance, who can offer just an example and a path to a different way? Ms. Jennings, do you have anything?
Thank you, Councilmember Payne, for that question. I think that for every staff person that is a part of Lead Minneapolis, what we're looking for is a connection to community, an understanding of the community, and a deep commitment to community in the East Lake Street Corridor. And that is something that we prioritize during our recruitment process, because as you've shared, that means so much more than a person you don't know coming up to you saying, hey, I'm here to help you. When it's someone that I've been in a similar situation before, here's how I've gotten out of it, or here's where I am now, here's how I want to support you. There's a ton of peer-reviewed research around peer support models, and the level of effectiveness that has shown. The main thing that we do is support people in navigating systems, and having someone along the way that really understands what our clients have gone through is huge, is very huge. So as a caution, or maybe just an understanding of, there is a degree of, I think, distance or growth. And there's no 1-year mark, 2-year mark, 3-year mark that as an employer you can plan for or ask about or have that be a criterion. It's really individual to individual. And so as service providers who are implementing any sort of peer support model, I would say to this council is to understand that, yes, there may be staff turnover, or yes, there might be challenges, and there needs to be space and funding too for supporting employers and supporting their staff, to invest in self-care, to invest in adequate staffing so that people aren't running themselves thin. One of the things that I've witnessed is oftentimes individuals with shared lived experience also go home back to a similar situation, or they have family members or friends who are still struggling, and so they don't really get a break in between those two settings. And so without that investment in providing that break, or supporting and just understanding as an employer what someone may also still be struggling with at home or outside of work, that can have negative impacts. But when you have the support, when you have adequate staffing and support, like I said, of investment in employee self-care, that can go a long way.
Thank you so much.
Thank you, President Payne. Vice Chair Wansley.
Thank you, Chair Chavez. Sorry, I'm writing down my last point. Y'all are raising so many good things. Thank you so much, Sheila. You've been a consistent expert in the field and have worked with the city and the Fry administration on a multitude of ways of, as you mentioned, of us doing what's right when it's come to encampment. So you are absolutely on point when you've shared the city, or city leadership is very aware of what we can be doing better. And you also highlight the ways in which we are not doing better, and understanding that we know what's right. It's a choice to then spend upwards to $300,000 on closures instead of having wraparound services. It's a choice to dump concrete slabs in empty parking lots instead of doing best practices. In light of that, too, I also want to say thank you for highlighting the demonization that continues to happen by city leadership in regards to community members who they label as activists to diminish just regular people caring about the well-being of their neighbors, and wanting to see them have their basic needs met and acknowledging their humanity like anyone else. And to discredit the work that they do of holding barbecues, of being in community with our unhoused residents, again, engaging with them as humans, instead of acknowledging and uplifting the asset that we have in the city of Minneapolis of residents who care about one another. We would rather demonize that and discredit them and label them as criminals and everything else. So thank you for highlighting that narrative theme that we keep seeing from this particular city leadership. Also, thank you for highlighting the best practices around healthcare and making sure that that's centralized in our outreach at encampments, and thinking of a recent outbreak used to justify the closure of Camp Nanakoski a couple weeks ago. Again, not understanding, did we send those resources out? Again, not even understanding where is our homeless response team and what they're doing, let alone how are we coordinating with social service providers to get healthcare services at, be it Camp Nanakoski. And we also know there's many more encampments across the city in addition to Camp Nanakoski. How are we streamlining that? So now questions on that. Lots of comments of thank you, for highlighting some key points. And you talked about this in your presentation too, of a number of best practices. Just want to start with Avivo Village, which was very much celebrated post the Wall of Forgotten Natives as a model that we should be absolutely championing. I would love to know what's the status of sustainability right now of it? Because it's been either 2.5 years now since we've had it in operation. And then what expansion looks like. Because I know Councilmember Chavez brought forward contingency dollars last term, so we can expand this model.
Okay, thank you so much for all those remarks. In terms of sustainability of Avivo Village, I'm a consultant to Avivo. They are an over $60 million a year organization. Avivo is very strong. There is a huge challenge for every provider in the state of Minnesota. The state, while so much more generous than some other states, Louisiana, they've provided resources that maybe sufficed 10 years ago. But one thing that I know you all talk to providers, and I know you all talk to people who receive services. Every time I speak with any provider, specifically and engage with a lot of Avivo staff, Avivo Village staff, they say the acuity of what people are experiencing is so much more intense than even it was in 2020. So that is reflective of the opioid crisis, xylazine. You have so many people who need wound care. So we provide per person support that, as I said, may have sort of sufficed 10 years ago, but it's not meeting the need now, and that's system-wide. So in terms of sustainability, I think that what Avivo Village does is healthcare, and I think healthcare thinks what Avivo Village does is healthcare, and so I think we need to look more broadly and resource that. And Councilmember Chavez, Chair Chavez, is working with the legislators to talk about that. But again, one thing that Ms. Jennings referenced, and I didn't really talk about, is that we need a much more pragmatic spirit of collaboration with the county and the state. So that is how you address those issues. In terms of expansion, adding capacity, we just had a meeting with Chair Chavez and Representative Sensor Mira to talk through what's possible. The current site is an amazing site. The North Loop neighborhood has embraced Avivo Village. It is a leased site, and it's a renovation. So it's an older building. So there's a lot of needs and investment that have to be done by Avivo in that site that are really, really challenging. Great landlord, but it's a lease. So that is challenging in terms of adding capacity, but we're talking about how to do that. One of the ways may be to add more healthcare and HIPAA compliant soundproofing in a room that would be used as a clinical room. That could be something. There's space in the existing village for sure. They often have overflow beds, and all of you have been in Avivo Village. There's a lot of communal space that is less utilized than we thought it would be. So we could add some capacity there. But in terms of what we really need is we need at least another 100 beds. And that is based on the fact that at any given time, Avivo and the 10 other street outreach teams that make referrals to Avivo Village have about a couple hundred people, to be really conservative, that say, hey, if there's a spot in Avivo Village, I'll come inside. So we did seek shelter infrastructure funding, and I can say we did not receive it. We tried really hard to get a site, and we did not. And so that was a big detriment to our application. I don't know that that's why we weren't funded, but that was a missing piece. So we see a need to add beds, but thank you for talking about the current sustainability, because these nonprofits are, yes, they're independent entities, but you all, government, you literally ask them to do the equivalent of building roads and curb cuts and sidewalks, and then you underfund them to do that. It doesn't work, and it won't continue to work. So we've got to look at it differently, and we need more partners. And I do just recognize that Chelsea McFerrin is here. And one of the things she tried to do was similar to what New Orleans did. We need partners beyond just government. We need healthcare partners. We need foundations. I'd love to see the Minneapolis Foundation at the table. And we need a coordinated effort. And we need to stop letting this issue in particular divide us, because it isn't working. And it's embarrassing, and I'm ashamed when I tell people that I'm from Minnesota and we still sometimes evict people with SWAT teams. I'm embarrassed. So, did I answer your question?
You did.
Okay.
Thank you so much. Another best practice that I wanted to dive into, and both you and Ms. Jennings also discussed this too. I know I've heard from some of my colleagues of, why don't we just mandate or forcefully or involuntarily subject people to services? Kind of, the Mayor Eric Adams way or approach. I would love to hear your thoughts as, subject matters experts on this, why it's more important to have it be voluntary based.
Research shows us that involuntary commitment to any sort of service or treatment isn't effective. So what we do is, underline. I haven't encountered an individual that we've engaged as a client in our program who doesn't want better for themselves. And so we use techniques like motivational interviewing to understand, what is it that you see for yourself? Whether that is, I want to reestablish custody with my children. And so we break it down. Okay, well, this is what we need to do to get you there. Everyone has a picture for themselves in their life. And so we just make it a little bit more possible for them to achieve that goal for themselves. And when we use techniques that are evidence-based, like motivational interviewing, that's used throughout our healthcare system as well, to support and encourage behavior change, because that's what we're really doing. We're trying to change. If you think about for people like us who maybe said at the beginning of this year, I want to start going to the gym. I'm going to do that. And you might start at the beginning and then you drop off, and maybe you try again, you drop off again, and then maybe one day it sticks and you go several times a week for years. And so that is just the nature and the science of behavior change. There's steps forward, there's steps back. And so an approach that doesn't apply any sort of judgment about that sort of progress or backstepping, and that just acknowledges that is the heart of human behavior, show more success than involuntary committing someone to do something.
Thank you so much for showing or discussing the evidence-based metrics that guides why voluntary, involvement is such a critical part in being successful in this work. I had a couple of questions also about safe outdoor, but before that, when you talked about embarrassment, Sheila, also just was really sad to see. I get Duluth, I know in California, this is also something that's being explored in pursuit of safe parking space or safe parking. And knowing that I'm also working on a policy to respond to the fact that we have thousands of residential units here in Minneapolis that are currently vacant. And the fact that rather than finding ways to incentivize property owners and developers to fill those units, make them affordable so they can also be filled, we would rather instead allow parking space. Allow safe spaces for people to live in their cars. So that renews lots more motivation of getting that policy through. But in regards to safe outdoor spaces, I'm just thinking through slide 67 and seeing where it was this particular example in Denver was located as in between what seems to be apartment complexes. So I also was interested to hear what are best practice for locating safe outdoor spaces. Is it common for them to be stationed in residential areas, or have them on the outskirts of cities and areas zoned for industrial, or a hybrid? So we'll love to hear your thoughts on that too.
Well, there's a lot of different ways it's done throughout the country, but I will 2 or 3 years ago, Councilmember Ellison and others participated in a study session. We had people from the Low Income Housing Institute, and they cite safe outdoor spaces. They do a really interesting thing. They cite them only where they can get the consent of community members, and they create a community advisor committee that is made up of the entire community, so the people that would live there in the safe outdoor space and the people who all lived there before. The Low Income Housing Institute then, not every time, but they design their safe outdoor spaces to be temporary, and then they use that in a sense for land banking for future development of deeply affordable housing. It's really cool. In Missoula, Montana, it's way far away. It's kind of like it fits the character of the community. Like Seattle's like, yeah, they can be right here. We're going to engage with them. I think it's a matter of being really respectful to anybody that would be impacted, doing what we did when we first sited Avivo Village. We went to the North Loop Neighborhood Association. We said, hey, how do you feel about it? And then working through any concerns. So there isn't one best way, It's really that just like you wouldn't want to build an affordable housing complex and leave it to be unmanaged. You just have to make sure that there's, a structure and there's some guidelines and that it fits for each unique circumstance.
Thank you so much for providing that information. I was also curious to hear some of the best practice you've come across around motivating partners to actually come to the table and take responsibility over managing either a safe outdoor space. And I'm just thinking of when we had conversations this past winter about streamlining coordination between the county, the city, and other social service providers around supporting Encampment and Nikoski. Everyone was like, yeah, that sounds great. And then it came down to like, so who's going to bottom line this? And then it was like, wait, no, liability. So someone has to hold this work of like regulations. So I just was interested in hearing how you've seen responsibility be delegated out in managing these spaces too.
Well, it is different, So you have safe outdoor spaces, which Councilmember Ellison and Council President Payne saw. That's, they have villages and they have safe outdoor spaces. So that's their mission, right? In regard to a better situation for Nanokazi, I know most of the providers who were asked, and they didn't say no. They said yes, but with the resources, we need to do it right. Mm-hmm. So the key are the resources to do it right. One of the things that I would love to see from this committee, and I know that providers have echoed this, we know intuitively that when we fund LEAD, when we fund community-based efforts, we get better outcomes. We see money spent to close encampments in the way it's sometimes done here. I just think that in terms of motivation, they're completely motivated. Many of them are upside down. Many of them have vice presidents who are working overnight shifts. This is not sustainable. So in terms of a provider who would own it, you have to resource them. In the case of New Orleans, that city is talking about this constantly. It is, thanks to you all, now you are talking about it constantly. But it is talked about in the media. It is talked about at their Quality of Life Committee. They are problem solving. Nathan Fields is a genius. I think you all should meet him. He is working with landlords to say, hey, what is it going to take to shake these units loose? And it's really focused. And, I just want to say that, and one of the Quality of Life Committee meetings, Councilmember Harris, who some of you met, is an outstanding leader, just like you all. Someone asked the officer who's in charge of encampment response, hey, why don't we sweep? Why don't we just sweep? Why don't we just do what other cities do? And to paraphrase, he said, hey, these are our neighbors, and they're just going to pop up somewhere else. So you can do it. That's why I started my presentation with that. Minneapolis, you can do it. It is will. We can do anything. We bought an $11 million place to refrigerate bodies during COVID that we didn't actually need. We found that $11 million. We find the money we need for a lot of things that aren't helping people.
That's right.
You can do it. And we will help. You have people who will help you.
Thank you so much.
And I do just want to say, there's been some, Mayor Fry is not on the side of the issue that I am most of the time. But he did really support Avivo Village. He did. We came to him with it, and he said, we want to take the tiny shelters and put it in a warehouse, probably Kmart. Does that sound good? Then he said, if you can show me who will be the service provider, that sounds great. So we need to just drop whatever's going on where we're not working together and get back and refocus. And I'm new to New Orleans. It's almost 2 years. I'm definitely in a honeymoon period, but I really love how much they care about each other. And I know we care about each other in the same way. We just have to agree to work together.
Thank you, Sheila.
Thank you, Vice Chair Wansley. And Sheila, thank you so much for coming to committee. You've been a strong partner for the city of Minneapolis, and I truly believe that we need your experience here to navigate these very difficult conversations. More than 170 people in Denver have been permanently housed through a safe outdoor space policy. More than 170 people. This is something that can help Minneapolis residents across the city to address this crisis head on, and I just think it would make a big difference. So this is something that, in my opinion, needs to happen, and why we're working on that policy, and we'll be seeking your guidance as we move forward with that. There's also a bill at the Capitol that you mentioned earlier that I just wanted to note for the public record that would help with the expansion of Avivo Village in South Minneapolis, and I really hope that the state legislature passes this bill to help address this crisis.
You mean the bonding bill?
Yeah.
Yep. So please support the bonding bill for Avivo. Yep.
And then the city and county can help and should help stabilize the current site, and how we can even add extra capacity at the North Loop location. This is a multi-jurisdictional approach. The city, the county, the state, and federal government needs an all hands on deck. And I truly think that if we all work together, we can address this and even help with the Avivo Village's priorities.
May I say one more thing?
Yes.
I forgot something. One thing you could do for providers is try what they do in Duluth. They work together, and so in terms of funding, they're not pitted against one another. So if we could start talking about that, because I'm up here, Avivo. There's AICDC. There's Agate. There's so many wonderful providers, and they help and support each other. But we need to figure out a way that we can actually resource them to the level they need. So.
Thank you, Sheila. You're right. There's a whole bunch of housing providers and
Yeah.
Organizations that really need our help, and I think the state legislature, the city, the county can all be helping right now. And we are, but we need to do more on that. So I do have a few questions, and it's going to help us guide through next steps through this committee and that we can move forward on. So one of the ones I have is, do you think that safe outdoor spaces will help address some community safety concerns? I've met with residents in my ward, some who live next to Encampment, and have expressed, their safety concerns next to Encampment. So just want to make sure if you would answer that question.
Do I think that safe outdoor spaces could address community safety concerns? Yes, absolutely.
And can you explain why you would think that?
Because part of the foundation of a safe outdoor space is that there's some kind of provision for safety and security, and there's some provision for lack of a better term, ensuring that the people who are living there are buffered by any of the other elements that might try to impact their lives. And that's a big issue. I know that we have people here from Phillips. I think Phillips has had 20 or 30 encampments in the last 5 years. 29. So I certainly think having the opportunity to have a safe outdoor space would help. Again, I really just want to caution everybody, and I don't think any of you would do this, but it cannot be used as for coercion, right? You can't be. It's not like semisonic, right? Oh, you're too young. But it's not like you don't have to go home, but you can't stay here. Like, no, you can't do that. But yes, it can help, and it can be a relief valve. It can. I don't know anybody who would prefer to be under-resourced and versus resourced, right? That's why that service tent worked. There were things people needed, just like when we need something, we go there.
Thank you.
Yep.
Some people say homelessness response is the responsibility of the county and not the city. What would you say to somebody with that position?
Well, I would ask the people impacted in Phillips if they think it's just the county's responsibility. Livability is all of our concern, and our lives are the situation is so much more complex than when we maybe were able to have these siloed, like you do human services, we do infrastructure. The city is responsible for life safety issues, zoning, and making sure that we have a safe and livable city. I think I forgot to say something else. The New Orleans Police Department, nobody's perfect. There's lots of problems, right? But they do respond to calls in encampments. And we know that that doesn't always happen here. So I think one of the things people say about Aviva Village in terms of a first responder's perspective, they like to know people are safe. They like to know where they can find them. They like to know how they get in and they get out, and a safe outdoor space can replicate that. I think people should be inside. I'd rather see a bunch of small indoor villages. But not everybody wants to be inside. So we need to meet people where they are.
Thank you. I know there's been a lot of public discourse on safe outdoor spaces, but do you think, or have you seen a model, do you think that safe outdoor spaces legalize encampments on sidewalks or every encampment in the city of Minneapolis?
Absolutely not. Nope.
Thank you. The policy we're exploring in the city of Minneapolis will require going through a permitting process. Community members in my ward, some who are here today, like Donna and Jana, have expressed wanting to pilot these programs in 4 locations in the city of Minneapolis. So I do thank you both for being here. I have another question. What do you think it would take to reestablish a navigation center in the city of Minneapolis to address homelessness? I know you had a little slide that talked about the navigation center, but
Well, one thing I want to, Camp Ninakazi and others, but right now that's the one that's top of mind. They came up with a list of demands, and one of the demands was a neighborhood hubs, neighborhood navigation centers. I think that's brilliant. I'd love to see that. I think, having some elected officials would like to see Aviva Village expand to like 350 people in one place. 100's a lot. Research says 25 to 30 is a thing that feels like community. So maybe in some cities, in Sacramento, for example, the mayor there has said, hey, each council member, you need to have a homeless response in your ward. So perhaps we could have small navigation centers where it's needed. I don't know if we need one in Linden Hills, but we might if we don't address the opioid crisis, because it's all over, and it's certainly there too.
thank you, Sheila. And then the last question I have, and this is more as we're developing our response as a city, do you know how the partnership in New Orleans, since you're doing work right there, came about, and how this committee can learn from that work?
Well, I sort of touched on it. There's just this constant focus and effort and collaboration. But one of the main reasons it's working is because they have a point person in charge. And again, that's Nathan Fields. The city had that, and now you don't. I think you need it. And you had a fabulous person in that role. You need it, just like anything. How did the stadium get built?
Thank you, Sheila.
Yeah.
And then I'll pass it to Councilmember Ellison.
Thank you, Chair Chavez. Sheila, it's great to see you. This is, when I think about this issue, I get a little bit almost traumatized, because we've been at this for a long time, and I think that our entire time knowing each other has been on various sides of government trying to figure out what the solution is going to be, and you have been a tremendous advocate, and obviously not alone, but you've been a tremendous advocate. I often feel like a majority of our problem is less technical and more political. We talk about the navigation center here. I know I remember the conversation leading up to that. I remember the original structures that they were going to use, which were going to be much smaller, provide no partitioning, even less privacy than the sort of lack of privacy that we got. And so, that whole history and all that stuff is definitely top of mind for me. And yet it was a solution at the time. Mm-hmm. I know in the intermediate time, there's been a little bit of a narrative that feels a little revisionist to me, which was that the navigation center was a disaster, and that it didn't work at all, and those type of things make it so that when we try to re-engage these conversations, especially newer council members looking at the past, saying, "Hey, look, this is something that felt like a solution." How do we, what are some of the just from your lived experience in engaging in this work? I know that you and I see Kira Rankine in the back there. Avivo obviously is the one who's executing the technical expertise when it comes to Avivo Villages, but I know that you two, again, not alone, but you two are a big part of overcoming the political challenge of getting that off the ground. How do we overcome some of that? How do we overcome some of those political challenges? How do we change narrative? Because I think that that's mostly what we're dealing with, even when it comes to safe outdoor spaces, which is something that council members in various forms have been trying to propose since, I think, 2019, that the wall you end up hitting up against are narratives like, well, this is going to encourage people to live outside. This is going to, these are the types of things that you come up against. It feels ridiculous to some of us, but it's a line of argument that ends up being really successful in destroying potential solutions.
Well, to go back to Ms. Jennings, data, you're already doing it. You're going to other cities where it's working. In terms of overcoming the political roadblocks, I think elections, a joke, or not, again, I think it's illustrative. Mayor Fry and I are not on the same side of these issues, but he was a supporter of Avivo Village initially. And, I don't know how he feels about it right now, but it's doable. I guess I'd like to see the opposition. They're not here today. And I know you feel the same way. We don't want to see people living in safe outdoor spaces. We don't want to see people not having a home, but we do. So is there funding to bring, my gosh, Duluth, some of you remember this, Kira? Duluth brought their entire delegation, their mayor, their full county board, a bunch of administrative leaders came down to Minneapolis in December 2021 because we were doing such a good job. And they wanted to see Avivo Village, they wanted to see Envision, they wanted to see Settled, which is a faith-based intervention, which is really interesting. I can talk about that if you're interested. So they all came down, asked a lot of questions. They saw the DID storage facility. They were really impressed by that. John Cole, who used to run the Dignity Center here, is the staff person who is the head of their continuum of care, and he coordinates that coalition I showed you. They all work together, and they already have the Safe Bay, and they already have the enabling ordinance for safe outdoor spaces. They did it in Duluth. You guys can do it. I don't know if I'm answering your question. I'm being a little flippant because I'm frustrated too.
Yeah.
Yeah.
I think I think you answered the question plenty, and I'm excited to see sort of us re-engaged in this discussion in a serious way. I really want to thank my colleagues for making sure that this discussion isn't just sort of given up on, because I know that we've hit our heads against the wall a number of times over the years, and so but you're still at it. If you and others can be sort of a source of hope for us to not give up on this issue and for us to continue educating ourselves as a city and developing strategies or tripling down on strategies that we've never executed, I think that is I think that that's really important. So thank you thank you for being here and coming back up here from New Orleans. I know we got you on a really cold day, but yeah, no, I just appreciate it. And Ms. Jennings, thank you for your presentation as well, and the kind of services that you provide. I think that we are learning as a city that to your point, we're not going to be able to remain siloed in these issues. I think that my colleagues who bring up those points up do so with really good intentions, and I think that they make a valid point. If Councilmember Rainville will often say, like, everything that we pay for, the county won't pay for, right? Mm-hmm. I don't think that it's so simple, but I think it's fair to make that point so that we have it in mind, and so that we're not accidentally. The point is for many hands to sort of like be a part of lifting this thing, not for one set of hands to replace another set of hands. That doesn't really add to capacity. And so I hope we're all sort of hearing that message and being willing to lean into collaboration. But that's more of a comment, less of a question. But again, thank the both of you for being here and giving your presentations.
You're welcome.
Thank you, Councilmember Ellison. Vice Chair Wansley.
Thank you, Chair Chavez, and absolutely thank you, Councilmember Ellison, for talking about some of the dynamics that we hit when we get into this place where we're trying to encourage collaboration, at least on the council side, and constantly are hitting roadblocks. And oftentimes it's really like a real life action meme of the Spider-Man meme where everyone is just like, you do it, it's your fault, it's your fault. And it's just like, it's all of us. Like, we all have a collective responsibility. And that's why I mentioned of the liability. People do not want to take responsibility because we have demonized this issue so much. We have basically have framed it as unsolvable. And to think that places like Austin, Texas, that has a way larger populace than we do here in Minneapolis, and knowing that we actually have a pretty modest population of those who are experiencing homelessness or unsheltered homelessness, that if we did have real life collaborations, we could actually be one of the cities that had a success story saying that we did not have homelessness, that we eliminated it in 10 years or 5 years.
Yep.
So the fact that that is actually possible, and I think as Councilmember Ellison highlighted, it's the political will that gets in the way, or the lack of political will that gets in the way of us actually making that possible. Sorry, that was a comment.
Okay.
Also a little soapbox. I actually did have a real life question about the settle, only because I also had the opportunity a couple years ago to visit when they were just piloting it out, and definitely wanted to get a sense of where does that stand? How have people received it? I know some people have different hesitations around faith-based models. But you mentioned, talking about settle. I would also love to hear a little bit more about that and where that work is standing.
Yeah, and so I agree, and I think it's really great that you brought up the fact that some people have feelings about faith-based process. Some people don't. Some people have feelings about me or Ms. Jennings or you. It doesn't matter at all. You need a lot of different responses. So in terms of settled, it's really interesting because they do create housing for a person who's experienced homelessness, but they also insist, and to have a congregation participate, they insist that a missional, a family, or an individual also live there, also live in a tiny home. So it's completely grounded in faith and building a sense of community that I think is quite astounding and admirable. And there's a few. I'm not sure how many there are. I know we were just discussing it, but that's a possibility. Retiring Representative Frank Hornstein was asking if maybe we could do some like safe bay parking, kind of scattered site safe bay parking, like where you would ask a neighborhood to kind of take on a few vehicles, or so that's kind of the model. Settled's usually just very few residences, and it's very much engaged in whatever faith-based practice that congregation has.
Also, now that you also raised the safe parking piece, just thinking of Ms. Jennings' presentation, do we have any figures that identify an average number of folks who have access to a vehicle that is experiencing housing insecurity? The fact that you said we have a substantial number of folks who don't even have access to a phone, let alone a vehicle. So also being cognizant of what do we need in this moment? I'm pretty sure just want to know if those numbers were out there somewhere.
You go ahead, yeah.
Thank you, Councilmember Wansley, for that question. That is an interesting one. I don't have hard numbers on that. We do spend quite a bit of our client support funds towards transportation. So we do Uber individuals or use Lyft or rideshare or provide bus fare and tokens for individuals. That is another, and we utilize our facilities or agencies' vehicles. That is a barrier when someone gets a housing appointment, say, and they're going to take tours to pick their spot. And so we drive them to those different places so that them not having a vehicle isn't a barrier. But now that you said that, that is a thing anecdotally that I've seen come up. But I'd be happy to provide additional numbers or data on that, but I don't have that offhand. Thank you.
Yeah, that would be awesome. But yes, no, thank you for providing some context. And actually, if could you give like a basic summary of what the Settle project is?
So the Settled project came from two University of Minnesota students came together and had a vision for a different response to homelessness, and they designed initial structures that are they're mobile, and then they I think I might be. I recall in general how it began. They started talking to congregations to see who would be interested in doing this. And, families moving forward, I think you are aware, families who are experiencing homelessness already, we have a robust Families Moving Forward program in the metro area where congregations host them for a period of time and also try to leverage the sort of tangible resources and intangible resources of their congregation to help them. So it's kind of happening. It just isn't a structure. And it's temporary. So that's the difference with Settled, is that they can be there, I think, as long as they need to.
And is it common with these congregations? Because I will note the one that I saw, they were building the mobile tiny homes at the time to transition it onto a pretty sizable parcel that they own. And I'm just thinking of like your average congregation or church in Minneapolis who has land like that.
Right.
So just wanted to get a sense of like how,
Well, one thing I will note is that in a lot of cases in Colorado, those safe outdoor spaces are in parking lots. So you could look at that. It's a big none of this is easy. It's a big ask. But if a congregation is so moved to do something like that, I bet they would find a way, especially if they knew that they'd have support.
That is true. And as someone who loves God, Jesus definitely took care of unhoused people, for those who are confused about that. But that's all.
Thank you, Vice Chair Wansley, and thank you, Sheila and Latasha, for being here today. We really appreciate your expertise in helping guide this committee in next steps. So, seeing no further questions, I will direct the clerk to receive and file that report.
Thank you.
Finally, we have one item that we have added to the agenda, item number 9, which is a joint powers agreement and common interest agreement for the 2025 joint disparity study. Committee members have a written request for committee action in front of us today, but I'll ask staff to give us a short summary of this request.
Good afternoon, Chairman. My name is Johnny Burns. I'm the Director of Contract Compliance for the city. The Joint Powers Agreement is an agreement between the state and a few different parties, as well as a common interest agreement, to sign on behalf of the city for the disparity study. The disparity study is necessary to have the small underutilized business program. Our program ends in December of 2025, and the study will be completed by August of 2025. Our share of that study is very small compared to the overall cost of the study, and right now they need us, if we're going to participate, to sign a joint powers agreement to start conversations with the consultant that was hired, or that the state hired for the study.
Thank you so much. Seeing no discussion, I will move approval of this item. All those in favor say aye. Aye. Those opposed say nay. That item carries, and it will be forwarded to next week's council meeting. Seeing no further business before us, I will declare this meeting adjourned.